Prolonged exposure therapy is a form of trauma treatment. It treats PTSD or post-traumatic stress disorder, although it can treat other forms of trauma as well that don't necessarily fit into the criteria that would give a diagnosis. Prolonged exposure uses exposure to be able to help a person stop avoiding the cues that remind them of a trauma that they have had in the past. Oftentimes when people have experienced trauma, they become avoidant of some of those memories that they have experienced simply because it's quite awful to have to relive those memories and experiences over and over again. However, the problem with avoidance is that even though we think we're choosing to avoid, those cues happen anyway, and the memories come back in a way that feels like we don't have control. Prolonged exposure will allow us to have control again of those memories and know what to do when they come up, and to start to expose to them purposely and with intention so that we can get to a point of having desensitization over the emotions that they bring up. Desensitization means that if we allow ourselves to be exposed to the cues of the trauma over and over and over again, eventually those cues lose their strength and they no longer create the same emotions that they did before we started the treatment. Most people can go through the entire procedure within about 12 weeks, and sometimes it can be even shorter. So although it is very difficult to do trauma treatment in the sense of having to bring up these types of memories again, the nice thing is that the outcome, the positive outcome that can come from doing the treatment, happens quite quickly.